Welcome to the deep dive. Today we're tackling something massive, chronic diseases. Just think about it. These conditions cause, what, 41 million deaths every year?
That's right, it's nearly 74% of all deaths globally, a huge number.
And here in the U.S., the cost is unbelievable, 86% of healthcare spending.
Okay.
It's a major burden.
It absolutely is.
But maybe there's a way to, shift things, make patient care better, maybe more efficient, and hopefully cut those costs. We're talking about AI, artificial intelligence.
Exactly. And what's interesting for our deep dive today is that we're drawing on this really comprehensive bibliometric analysis. It's from the Web of Science core collection.
Okay, bibliometric analysis. Break that down a bit.
Yeah, basically it's like mapping the science. It shows us who's doing the research on what specific topics, where they are, and how it connects. It gives a really systematic picture of what's happening right now.
Got it. Like a bird's eye view of the research field.
Precisely. So our mission today is to kind of unpack all that, see the main trends where AI is really making strides, but also, and this is crucial, flag the challenges we still need to figure out.
Okay, let's dive in then, because the research itself, well, paints quite a picture. This huge spike in publications just in the last decade or so, right?
Oh, absolutely. Explosive growth. Between 2013 and 2024, that's where over 95% of all the papers on this topic came from.
Wow, 95%. That tells you something big is definitely happening.
It really does. And leading the charge, research-wise, it's the United States. They're contributing like over half of all the publications.
Okay.
Yeah, with China coming in second. And there's quite a bit of teamwork happening, especially between the US, China, Australia, Canada. Those major players are collaborating a lot.
So this analysis, did it group the research into themes?
It did, yeah. It found 4 main clusters, sort of focus areas. You've got diagnosis, then general care, telemedicine, which is huge now, and then the underlying technology itself.
And any hotspots?
Yeah.
Things really taken off recently.
Definitely. Mobile health tech, so things like apps and wearables and machine learning, those are really popping up as key focus points, especially in the last few years.
Right.
The analysis uses something called keyword bursts, basically words that suddenly surge in popularity, and those terms point right to where researchers think the real potential for impact is. Putting AI into everyday devices, using it to crunch all that complex patient data.
Data that humans just couldn't process on that scale.
Exactly. That's really where the cutting edge seems to be.
Okay, so we know where the research is happening and the big themes, but how is AI actually being used right now for specific chronic diseases?
Good question. The sources point to conditions like diabetes, hypertension, COPD, chronic obstructive pulmonary disease.
Right, so for diabetes?
For diabetes, AI is helping with earlier diagnosis, definitely making treatment more personal and enabling that kind of constant monitoring. Imagine an AI looking at your glucose readings and predicting a drop hours ahead, helping adjust things proactively.
That sounds like a game changer for managing it day to day. And hypertension.
Similar ideas, predicting risk, tailoring treatments, even using smart devices for real-time blood pressure tracking. And for COPD, it's about getting the diagnosis right, figuring out severity, and again, that remote monitoring to catch problems early.
So it's not just treating, it's predicting and preventing complications too.
That's a huge part of it, yeah. The study really stresses AI's role there, like predicting hypoglycemia risk in diabetics based on their patterns, or flagging the likelihood of a flare-up in someone with COPD so doctors can step in sooner. It's about safety, improving quality of life.
And you mentioned machine learning earlier as being key. How does that specifically help? What makes it so powerful here?
Well, it's incredibly good at finding patterns in massive data sets. So for diagnosis, it can sift through electronic health records, medical images, even genetic data, potentially spotting diseases earlier and more accurately. And then for treatment, it can help personalize plans, like figuring out the absolute best medication dosage for your hypertension based on how you've responded before. Plus, it helps with the bigger picture managing hospital resources. And like we said, powering those continuous monitoring devices, it really changes the whole approach.
It sounds incredibly promising, but there have to be hurdles, right? Challenges.
Oh, definitely. And the research is quite clear on these. First, while the amount of research has exploded, the overall quality and academic impact hasn't always kept up. We need more really solid, high-quality studies.
Right, more rigorous validation.
Exactly. And then there's a geographical imbalance. South America, Africa, these regions are really underrepresented in the research landscape and in international collaborations. That needs addressing.
That's a big gap.
It is. And then there are the practical issues for actually using this in clinics. Data privacy is huge, obviously. Security, too. And making these AI models understandable, explainable AI. If doctors can't understand why the AI suggests something, they won't trust it.
That makes sense. The black box problem.
Precisely. And maybe most importantly, we just need more systematic clinical trials and long-term studies to prove this stuff really works safely and effectively in the real world.
So, stepping back, the potential for AI in managing chronic diseases seems immense. It could really boost efficiency, improve outcomes for
The
patients.
potential is absolutely there, yes. Revolutionize things, maybe.
But getting there means, okay, more high-quality research, definitely building stronger global partnerships, especially with those underrepresented areas,
Critical.
and really tackling those tough issues head-on. Data privacy, making the AI transparent, and that crucial clinical proof.
Couldn't agree more. It's a path, but there's work to do.
So, thinking about all this,
Right.
what does it actually mean for you listening? How might AI start to reshape the healthcare you actually experience in the coming years? Something to think about.